What's that meme from that old zombie movie? He's got the shotgun. He's like, shame.
Yeah. Because he's loading it. Hey guys, Kevin here from LOA. Joined today with my friend Andrew, and today we're going to be going over medical considerations for your EDC, your car kit, and your Overt kit. So this video is going to be an overview on the what and the why of what you should be carrying. And yeah, stay tuned.
Thanks for having me, Kevin.
No
My name's Andrew. I'm a nurse and former EMS. I have experience in the pre-hospital side and experience in the emergency, both as an EMS instructor as well as in emergency departments. My current specialty is cardiac, and we thought we'd make this video to discuss some of the equipment that's out there. It's very common, and why you might select it for your personal needs. A lot of people will purchase their first firearm. They'll get a quality holster like LOA, and then they start looking out and going, okay, well, I want to carry some sort of medical gear with this. A lot of these critical incidents that we're seeing on the news, terror attacks and so forth, people are realizing that there's an afterside to these events, and there's a high likelihood that your most critical involvement in these events will have nothing to do with firearms. It will be treating the wounded. And so we want to inspire and empower our professional end users, our police and law enforcement, military, as well as our lay responders to be more useful and effective in these types of situations. So without further ado, let's get into some of this equipment and help make you a more informed decision on why you may or may not select this. So for starters, we have bleeding control. This is a CAT tourniquet. They're very commonly seen. We got this from atomicdefense.com. A lot of this equipment can be purchased from them, so big shout out to them. We like them. Yep. The reason you carry this is to help stop an arterial bleed in a limb. So this is a valuable piece of equipment. Time is tissue, as we say in the medical space. As oxygen delivering blood and hemoglobin fail to reach an end organ or tissue, you end up with end organ damage, which results in organ failure. So we want to be able to keep blood inside of our patient and keep our blood pressure up to be able to provide blood flow to the brain and vital organs. Other tools we can use to meet that end goal are sponges. So we have a variety of sponges here. These are sponges that can be purchased off of Amazon. Very common to be seen in the fire, EMS, and hospital space. We have 4x4s and roller gauze. I like these a lot. I've used them on many patients. I like these roller gauze because you can. It's just a big wad of sponge, and I can shove that directly into a wound and get an immediate result. The 4x4s are very good too, maybe for something that doesn't require as much absorbency. I can fold these into 2x2s that have a nice thick 2x2 pad, place that on there with the help of some Coband or other tape. And so these are very useful. So they're cheap. We recommend having these in your kit. Typically, these don't come in very waterproof packages, so that is something to consider. For more of the tactical side, we have these North American Rescue that come in a real tough plastic packaging, which is nice. And they're Z-fold, so they're a little flatter. It accomplishes the same goal. You can do the same things with it, but these are kind of nice to have. And so you can get these from Atomic Defense. Very, very valuable piece of kit. Here we have medicine imbued sponge, Combat Gauze, and it essentially acts like a clotting factor, which causes a clotting cascade and helps clot the patient's wound faster, resulting in hopefully less bleeding on your patient. We use the MARCH protocol, massive hemorrhaging, airway, respirations, circulation, and then hypothermia, shock management. We want to address our bleeding first, our arterial bleeds, our massive bleeds first, then we go to our airway. And we need to secure that airway before we start breathing for our patient or making sure that they can breathe. So we can do that with a nasopharyngeal airway. That's an upper airway. This is a layman's airway. With proper training, you can appropriately apply this, and it can be very valuable for your patient. Next, we have oropharyngeal airways. and these help hold the tongue in place. There's a variety of reasons why you would use these. They come in different sizes, and with appropriate training, these can be very, very valuable in helping your patient keep their airway open. Again, the layman can apply these. They don't go into the trachea. They're upper airway units. Moving on to respirations for your patient, the bag valve mask, we recommend having these if you have a little more space in your kit. Not commonly seen in the tactical kit very often for some reason.
Big and scary.
But they should be because they're a critical piece of the emergency equipment that you'd use in EMS, fire, and hospital space. We use these to help breathe for our patients, respirate our patients. Obviously, there's better ways to do so, but from a strictly emergency standpoint, they're fast, they're quick to deploy, and if used correctly, they can save a life. So your ability to assess for that is a whole nother matter, and your ability to apply these tools is a whole nother matter. But we recommend you seek out training, which isn't that difficult. We are going to have more content on the channel moving forward on this type of equipment, but this is something that we recommend, especially in a vehicle. There's really no reason not to have it. They're fairly cheap. You can get them for $50 roughly, give or take, $10 or so. And can absolutely save a life if applied correctly.
They're locking lips with a stranger as well.
Absolutely. We've got a few other tools, hyphen chest seals. Again, get these from Atomic Defense. The lung compartment requires a certain negative space, the pleural cavity, to hold the lung in, keep the lung inflated. Once you start introducing penetrating trauma through gunshot or stab wounds or other mechanisms there, the lung will collapse as air rushes into that space. So this helps you create a one-way valve to help air to escape and hopefully keep the lung inflated enough that your patient may survive transport. So this is a valuable tool that you should absolutely carry in any kind of tactical trauma kit.
Yeah.
So very important. Some of our assessments tools, and again, something you don't see too often. I don't know why, but this is a pulse oximeter. Very valuable it can be a valuable tool for measuring oxygenated hemoglobin or bound hemoglobin in the peripheries, on fingers, toes, and so forth. Sometimes we use them on ears, and it can, if used correctly, it can give you a quick and active heart rate, which is nice to have for various reasons. And it helps put together that picture for your patient of how your patient is clinically presenting. This is a valuable diagnostic tool to have, again, if leveraged correctly. Last but certainly not least, our body substance isolation using gloves. You can get these nitrile gloves off of Amazon for pretty cheap. You can get different sizing to match your hand. We recommend putting them anywhere you're putting this equipment. If it's wet and it's not sweat and it's not yours, don't touch it. So we recommend put that on before you contact your patient. What your threat profile is, what you are trying to address, will dictate what equipment you need. Then from there, go to, okay, which pouch should I choose? Do we go with a Blue Force gear pouch because I'm doing some sort of tactical thing with a belt, or a plate carrier? Go to Spiritus and Faro. They've got the different size pouches. You can get some big ones now, and backpacks. How big or small are we going? So that's up to you. But if you have questions, feel free to leave them down below. Wereach out to us. Go to Atomic Defense, get your medical gear. Go to LOA, get some really good holsters, and we're gonna do this again.
Yeah. We're definitely going to follow on videos, going deeper into the rabbit hole on each of these subjects, treating casualties, the philosophy behind it all. We got a lot planned, so stay tuned. And yeah, just be sure to like, comment, subscribe would be great for the algorithm, and just share this knowledge with your friends. Help us spread this far and wide. It would be much appreciated. But all right, other than that, thank you guys.
Thanks for tuning in.